most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
All right, today we're going to talk about 5 tests
Tests,
to
plural.
stop back pain in sitting, standing, lifting, and while you're in bed. And the thing is, what's good about this, you can perform these tests yourself.
Exactly. We're really teaching people to be their own therapist, pseudo-therapist,
Right,
to a degree.
self-therapist.
Yep.
The idea here is that we're trying to figure out what causes your pain. If you can figure out what causes it, what specific movements, you can maybe figure out what to do to stop the pain.
Say no more, Bob. That's the key. But before we go any further,
If you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. This week we're giving away one of the Bob and Brad Fit Glides.
That's
These
right,
are
Bob.
awesome. These are a great exercise tool, especially if you're going to have knee replacement
Absolutely.
or any type of lower extremity surgery.
or if you got a lot of arthritis in your knees and walking is painful.
Yeah. All right. You can also find the contest will be pinned to the top of the page in Facebook, go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
Absolutely. Bob, before we go any farther, I wonder if people have noticed a little difference.
Oh, yeah. We're starting to add stuff here. We're in a new set, and we're starting to add a little bit of decorating.
Right, and now because, the memory thing, all we have to do is look back if we forget our names.
I'm the top one. So,
Yeah.
All right. Today, let's start off with number 1. So we're looking for pain triggers. What starts your pain? These are 5 tests you can do. Let's start in bed, Brad, because you wake up in the morning. Sometimes people go, I wake up and the pain's right there right away.
Exactly. Let's start there. It really is the best place to get this thing going.
I put a pillow on there. You don't want it?
Well, Bob, I don't know. I just
Go ahead.
threw it off.
So,
It's just part of my routine. Throw
all
the
right,
pillow
so
off.
visualize this. Brad wakes up in the morning, and Brad does have spondylolisthesis, so a lot of times it may be hurting in the morning.
Actually, I'm typically a little more stiff in bed.
Sure.
So
the first thing what people do if they're lying
Yes.
on their back is they're going to turn. And sometimes what they'll do is they'll turn their body first
Yep.
or turn their back. So first thing I want to see, does any of these directions bother you?
Oh, actually, this is not fun for me in the morning.
This turn.
If I rotate, yeah.
Okay. And the same with this way.
Yeah.
One may be going to be fine, one may not be fine.
Right.
So,
As a matter of fact, I've had patients who had to change from one side of the bed to getting out on the other side of the bed because it was much easier
they
to
can
get
turn one way, but they can't turn the other way.
Precisely.
Yeah, exactly. Okay. So let's say Brad finds out it does hurt to go like this.
Oh.
So now he knows that in order to get out of bed, he has to turn his whole body and roll like a log. See, that keeps the back protected.
It does feel better, Bob.
Now, the next step is he brings the legs off here. But now let's say you're going to bend up wrong, Brad. So, yeah, see how he's curling his spine? He's curling it, twisting it. Yeah, let's say that hurts. So now he has performed another test, the bed test, and he's going to figure out he needs to get up like a column.
Right, like my whole trunk is in a cast.
Yeah, right.
So I'm going to tighten up my core muscles and put that cast on internally, and I'm going to take my time and go up like this and keep that spine neutral. Yeah, that's better.
See, what he did is like you said, he tightened it up. Because you could do that without tightening up, and it might still hurt.
Right. If I just,
this is bracing your back, getting it ready. It's quite a useful thing to do, by the way.
Exactly.
We'll show it later on with lifting too. All right, Brad, let's move on to sitting. You want to grab the chair? All right. A lot of people sit all day long for a living.
Oh, you want me to put it down?
Yeah. Grab the chair, put it down. Okay, Brad, why don't you sit down?
How is this, Liz, in her new digs?
Okay. So first, when you're going to sit, I want you to sit slumped to see if that bothers your back. All right. Now, it may not bother it right away because sometimes it takes a while, but we'll accelerate this a little bit. Then I want you to sit straight. These are the tests. Sit straight up, and see if the back feels better that way. You may use a rolled towel between lower in the lower back too to hold it.
Yep, lumbar support.
Now, but here comes the real test. I'm going to have you do it slumped again, Brad.
Okay.
But this time I'm going to have you grab the bottom of the chair and pull on it, which is going to put some compression through the spine.
So I'm trying to like push my shoulders into my hips.
Yeah. So, and if that hurts, now I'm going to have you try it the same way. It's completely straight.
Okay. So back to good
Yep,
posture.
and now he's going to pull up through the chair.
Oh yeah.
And so, you know, if you find out you can pull up through the chair with your back straight, no pain, that shows you there pretty convincingly that,
Right.
that I'm sorry, I think I just spit on you, Brad. Yeah, convincingly that you need to keep that back straight throughout the day.
Right.
And maybe you can need a lumbar support or a rolled towel to help you.
And virtually a vast majority of people, you know, you need good posture.
Right.
Is very critical unless you have stenosis.
Stenosis
That
might,
might be
actually feel better to be a little
Right.
rounded out. So, all right, standing, Brad. How about we'll look at standing. So it's the same thing. He's going to slouch a little bit with standing. Feel that.
Mm-hmm.
Then he's going to try straightening up. Compare the two. Now this is one where he can actually slouch, and he's going to lift his heels up and drop them on the floor.
Little compression.
Yep.
Mm.
So there's a shock up through the spine.
Don't do that too hard the first time, because
Yeah.
if you've got back pain and you do it hard,
It might really give you a
yeah,
shock.
so just start gently.
But we want to see again, does it help to straighten the back? And now go ahead and drop the heel. Does it feel better? And if it does, again, this is teaching you the right way to why it's important to have that back straight
Right,
in
exactly.
the spine in good position. All right, with lifting, you're going to lift something with a rounded back. I'll go ahead and do this one, Brad.
Oh, sure.
Okay, and feel it. Then I want you to go ahead and straighten your back.
Yep.
And a lot of times I'll use the booyah stick. I suppose we don't have it here.
Oh,
yeah,
absolutely,
we got
right
it
there. And with this, you don't even necessarily have to lift an object. I think just doing
Yeah,
it.
bending over.
Yep.
Yep.
Especially if you're-
And you don't need a booyah stick, but this, I want you to visualize this.
switch to hands once, Bob.
Oh, yeah. I
Oh,
do
there
this
you go.
wrong, don't I?
It just helps a little bit for the camera, I think.
So you're going to imagine that you are maintaining 3 points of contact.
Yeah, here.
That's going to point out.
Head between the shoulder blades and right below the belt line.
So when I bend down, now I'm keeping everything straight, the spine straight. It can handle a lot more load. So you can compare those two. Compare lifting with a rounded back, compare to lifting with a straight back. And then finally, you can also compare it to actually tightening the abdomen when you're lifting. I found this out, Brad, when I was shoveling last year. I was like, I wasn't tightening my abdomen, and I was like, boy, my back is getting pretty sore.
Yep.
Right? And I started tightening. I was like, wow, that really made a difference.
Sure.
I was,
That's the natural
yeah, it's a natural brace.
brace. Yep.
Yeah.
So it's just a habit and things you need to be aware of. So that's why we're here.
All right, walking, the same thing. You're going to walk with your shoulders rounded. And then I want you to go ahead and take your arms and straighten back like this and do a chin tuck. This is a way to straighten your posture. Sometimes we have even people walk a little bit and pulling their arms back just to make sure. And then they let go like this, and they're in good position. Compare walking to slumped to walking straight. See what there's any pain. Compare. You also might look at long strides versus short strides.
Sure. Yep.
There'd be a little bit less force coming up through your legs if you're doing short strides.
Right. So yeah, you're striding out long and you can feel that heel impact.
Pounding. So, and you also might compare walking faster to slower.
Right.
Believe it or not, and I've seen this on many patients, when they walk faster at a higher pace, there's a little bit less stress on the spine. And when they're really ambling along slowly, they're really putting a lot of stress on the spine. So,
Which people might find a little confusing because we just said if you walk harder, or and it's kind of how you walk.
Well, it's the
do
pace.
you impact
Yeah.
or do you walk smoothly? It's kind of like the running technique
right.
we've talked. We're getting off track a
You
little
can
bit.
take
but-
short strides and still go fast.
Right.
Is
Right.
what we're saying.
So
So,
just be attention how you walk, and I think you'll find, if you walk uphill versus downhill, and not even a steep angle, you may find a difference. Uphill may increase pain, or vice versa. So, pay attention.
So we're trying to prove to here is that many of you can take control of your life and
Right,
your back pain.
right.
You can maybe make it turn on, and you can maybe make it turn off
Right.
just by what positions you're in.
Right. So avoid the things that turn it on, the pain makers, get rid of those, and do the things you want, activity and movement, but they should not irritate that back.
And remember, Brad and I can fix just about anything.
Except for,
A broken heart.
boy, you fell right into that, Bob. It was smooth.
Yeah.
We're getting better
For
at
once.
this. Yep.
Adios.